Good day, ma'am. I'm Carjap de Sablero. So this is my case study presentation. So I'll be discussing the severe anemia. So what is severe anemia? Severe anemia this is rare, life-threatening. Anemia occurs when your body doesn't produce enough red blood cells. So nakakause siya aplastic anemia, nag-include na infections, certain medicines, autoimmune disease, and also exposure siya sa toxic chemicals. So ang anemia is associated with bone marrow disease. So for the classification, uh, anemia can be classified as microcytic, thermocytic, and macrocytic. So nagadepend lang siya sa MCV, no? Ang MCV or mean corpuscular volume, which is mo siya ang diagnostic test. And naka-stated na siya sa above. So it can be hyper-regenerative or regenerative lang siya, which depends on the number of reticulocytes. For the causes of anemia, mo siya mga possible causes, nag-include na ang iron deficiency, lack of vitamin B12, folate deficiency, certain medicines, and also destruction siya sa red blood cells earlier than normal, which may be caused by immune system problems. If long-term or chronic, long-term disease such as chronic kidney disease, cancer or ulcerative colitis, or kanang rheumatoid arthritis. For the investigation, we have CBC or complete blood count or urinalysis, creatinine test, prothrombin test, and electrolytes, and also whole abdomen ultrasound. Okay, let's proceed for the patient profile. For the name of the patient MV, female, 83 years of age, significant others, niece. For the cultural background, Roman Catholic. Health status, wala kay ko sure sa diet history niya medications mo, ako na lang gibutang og not assessed. For the immunization status, none. History of present illness, again, naglibog ko og nalimtan na pala akong uban, so ako lang siya gibutang og not assessed. For the environmental health history, sa home environment, community, workstation, majority not assessed. For from head to toe assessment, first is the mental status. We have mood or facial expression, which is normal lang siya, and also able to communicate, and intellectual ability is not assessed. For the second one is the neurological status, ang iyang level of consciousness, awake. Sa head size, normal lang. Sa shape, normal gihapon. Condition of scalp, good. Ang iyang head condition, distribution, length, color, so normal, thin, and short black hair. For the eyes, shape is not assessed. Visual, same, not assessed. For the condition of the eyes, is normal lang. Repupillary reaction sa left pupil size and sa right is also not assessed. Sa ears, condition of the right ear and left is both good. So for the hearing ability, also good, able to hear sounds. For the nose, normal lang siya. NGT, none, oxygen, none. liter per minute type, none. For the teeth and gums, not assessed and also able to swallow siya. For any feeding tubes, none. For the neck, normal, carotid pulse not assessed. Proceed to thorax, respiratory rate, 18, which is normal na siya. Respiratory effort, none. Lung sounds, none. Sa cough present naman, also none. Sa described sputum, none. Sa ECG, none. Sa heart sounds naman, sa site apical rate, 72 beats per minute, which is normal na siya. Rhythm is regular. For the abdomen, auscultate bowel sounds or description and location. Not assessed, abdominal pain, distension, nausea, gastrostomy, tube or peg, all of them none. For the bowel action, the last LBM or last loose, bowel movement not recall, described tool not recall, colostomy none. For the integumentary, sa yung ethnic race, so Asian, any diagnostic skin color variations, none. Skin condition, warmth, normothermic, wet or dry to touch, dry siya. Turgor, normal. Hair distribution, normal. Edema, none. And pitting site, also normal. For the wounds, so majority na ko nga based on my observation, no, wala gid siya sa wounds. So all none. Sensation also dressing none. For the genitourinary, polycatheter, none. Described urine, not assessed. Voiding continentally or the other term described urine, not assessed. Any pain upon urination, so not assessed hapon. If continent or number of times attempts were checked and changed, not assessed. Any retention, again, NA. Any perennial lesions, none. For the extremities, color normal, temperature also normal, and moisture normal. So edema, pitting, and non-pitting not assessed. For the capillary refill, normal. Blood pressure, normal. Peripheral pressure not assessed also. And grasp strength in each hand, so weak. Sa musculoskeletal naman, not assessed. And sa pain, not assessed. For the pathophysiology of anemia, it varies depending lang siya sa nakadepend lang siya sa primary cause, no? For instance, in acute like hemorrhagic anemia, mo siyang restoration blood volume sa with intracellular and extracellular fluid that dilutes the remaining red blood cells, which results in anemia. So, ang proportionate reduction in both plasma and red blood cells result in falsely normal hemoglobin and hematocrit. So, ang RBC or red blood cells are produced in the bone marrow and released into circulation. Approximately 1% lang ang RBC nga ma-remove from circulation per day. So, imbalance ang production niya, no, to removal or destruction of RBC leads to anemia. For the drug study, okay. Actually, sa drug study, ibutang, mabagit ako ibutang. For the nursing care plan, assessment, objectives, patient appears weak and lethargic. Subconjunctiva is pale, lips are dry and pale, slow capillary refill, skin is cold, dry with poor skin, turgor, palms and sole feet is pale. So, ang hemoglobin niya, 77 grams per liter. So, which is 140 to 160. And sa hematocrin, hematocrin, rather 22%. For the nursing diagnosis, deficient fluid volume related to active fluid loss due to gastrointestinal bleeding as evidenced by hemoglobin of 77 grams per liter and hematocrit 22%. Hematocrit, rather. For the severe bleeding, for the inference, severe bleeding may reduce the flow of blood to the brain, causing confusion, disorientation, sleepiness, and even extremely low blood pressure. So, slow chronic blood loss may cause symptoms and signs of anemia, such as weakness or easy fatigue, paleness, chest pain, or dizziness. For the planning, in short term, after 8 hours of nursing intervention, the patient will be able to exhibit relevant normal levels of laboratory value, such as hemoglobin and red blood cell level. For the long term naman, after 3 days of nursing intervention, so ang patient will be able na maintain to a adequate fluid and electrolyte balance. For the intervention in independent, assess patient general condition and establish rapport. Also assess the vital signs, raise bedside rails, do bed bath and changing of bed linens, and also note the patient's individual psychological response to bleeding. And also we have to monitor the intake and output and correlate with weight changes. Also, we have to maintain bed rest, preventing vomiting and straining as to provide clear bland or bland fluids when intake is vision. For the dependent, facilitate in blood transfusion, administer medication as indicated. For the scientific rationale, to know condition of patient and to gain trust and cooperation from the client. We have to gather baseline data to provide safety and also to promote hygiene, and worsening of symptoms may reflect continued bleeding or inadequate fluid replacement. And also provides guidelines for fluid replacement and activity or vomiting increases intra-abdominal pressure and can lead to further bleeding. Caffeine and carbonated beverage stimulate hydrochloric acid production, possibly potentiating rebleeding. So transfuse all blood components that are low in the laboratory result. And for the evaluation, for the short term, after 8 hours of nursing intervention, the patient had to exhibit relevant normal levels of laboratory values such as hemoglobin and red blood cell level. For the long term, after 3 days of nursing intervention, the patient had maintained adequate fluid and electrolyte balance. Okay. Let's proceed for the discharge plan. This is my discharge plan for the medication. Medication, omeprazole, Omicron, 80 grams na siya. 80 milligrams, rather. For the exercise, non-treatment, continue home medications given by the physician. For my health teachings, take vitamin D and eat rich in iron foods such as meat, chicken, fish, eggs, dried beans, and fortified meals para may mao man yung mga kinahanglan sa atong lawas, no? And for the follow-up, check-up, so not assessed siya. Wala ko siya na-assess. So for the diet, eat rich in iron foods. So that's all for my case study presentation, ma'am. Thank you and God bless.